Can vision problems cause dizziness? Vision problems such as eye strain, blurred vision, or sight loss can cause dizziness in some cases. This is because visual information helps with balance and movement. However, the relationship can also occur in reverse. Conditions that cause dizziness could result in difficulty focusing the eyes. For example, inner ear infections affect balance and may make it look as though the room is spinning. This video explores the link between dizziness and vision problems, including the symptoms a person might have and possible causes. What is dizziness? Dizziness is the feeling of disorientation or lightheadedness. It is not an illness in itself, but a symptom of an underlying problem. This could be a medical condition affecting the eyes, ears, or brain. A person may feel dizzy if they have balance problems. Three systems work together to maintain a person's balance. The visual system, the eyes and their movement provide information to the brain about the body's alignment and position in space. The vestibular system, the inner ear, tells the brain about the head's position, motion, and orientation in space. The proprioceptive system. This includes sensory information from the muscles and joints that tell the brain about the body's position and motion. Dizziness is common in older adults, affecting around 30% of people over the age of 65. Symptoms of dizziness and vision problems. A person who feels dizzy may experience a spinning sensation or vertigo. Lightheadedness, feeling faint, the sensation of floating or swimming. Disorientation, difficulties with balance and coordination. Nausea and vomiting, changes in heart rate or blood pressure. Vision-related symptoms they could experience include trouble focusing the eyes, double vision, blurred vision, difficulties with depth perception. Causes of vision problems and dizziness. Several medical conditions could cause both of these symptoms, including binocular vision problems. Binocular vision is when two eyes work together to produce a single unified view. It is how humans typically see. When something interferes with this process, it can be visually confusing and result in dizziness, disorientation, eye strain, or headaches. Conditions that may affect binocular vision include eye misalignment, eye muscle weakness or paralysis, incorrect eyeglass prescriptions, traumatic brain injury, stroke or transient ischemic attack. Balance problems. The strong connection between the eyes and the vestibular system means that eye problems can negatively affect balance. Similarly, balance problems that occur due to disorders of the ears or brain can make it harder to see accurately. Vision plays an important role in calibrating the vestibular system through the vestibulo-ocular reflex. Vestibular-ocular reflex stabilizes the gaze while the head and body are in motion. Damage to the vestibular-ocular reflex can cause problems in maintaining balance. A 2018 study found that people with reduced vision are unlikely to be able to stand on one leg for at least a minute. The researchers used this exercise as a demonstration of poor balance. Conditions that may cause balance problems include ear infections such as labyrinthitis, motion sickness, concussion, vestibular migraine, Meniere's disease, benign paroxysmal positional vertigo, traumatic brain injury, hemianopsia, nystagmus, which is repetitive involuntary eye movement, blood pressure problems. Dizziness can occur as a result of both high and low blood pressure. High blood pressure can also result in damage to the eyes over time, particularly if a person does not receive treatment to manage it. Conditions that may cause dizziness include hypotension or low blood pressure, postprandial hypotension, an excessive drop in blood pressure after eating a meal, orthostatic hypotension, a sudden drop in blood pressure from abruptly standing. Eye conditions that can occur due to high blood pressure include hypertensive retinopathy, which can result in blurry vision or sight loss, choroidopathy, which can distort vision, optic neuropathy, which leads to vision loss. Other causes of dizziness. Dizziness can have many other possible causes such as dehydration, excessive exercise, low blood sugar, anemia, anxiety or panic attacks, certain medications such as sedatives and antidepressants, heat exhaustion or heat stroke. When to consult a doctor? While occasional mild dizziness is not a cause for concern, a person who repeatedly experiences dizziness, loss of balance, or who has noticed vision changes should seek help. If a person suspects that the dizziness is vision related, they may consider contacting an eye doctor to test their sight. If a person develops any of the following, get emergency help: sudden inability to move certain muscles, sudden weakness or numbness, difficulty speaking or understanding speech, difficulty walking, confusion, chest pain or pressure, pain in the neck, jaw or arm, severe pain in or around the eyes, sudden severe headache, difficulty breathing, very weak pulse, difficulty staying awake, loss of consciousness,